that there's an easy way that you could reach, for example, Michigan moms, to both offer them a fresh funds of $100, but hey, this platform also accepts your EBT SNAP card, and you can add your own funds and complete your whole shop. That's very different than here's an intervention and it's exactly for this, and then it's a one and done. We can really create like lasting, sustainable behaviors together that I don't think anyone else that doesn't have a consumer platform or a regular audience that's trying to constantly get better for that consumer audience can match that same level of service.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 384. Today, we have the Flava of the week about ZocDoc's What Patients Want report. How can we use the report to refine the direction of our consumer strategies in the coming year? I'll talk about that. Then we welcome Sarah Mastrorocco, General Manager of Instacart Health, to share the past, present, and future of the popular service and how tech enablement platforms can ultimately improve people's health. It's time for the awesomeness. Are you ready? Let's go.
Flava of the week.
We can learn a lot from ZocDoc's second annual What Patients Want report, which tracked millions of clicks on their site to see how patients' needs, priorities, and desires are evolving. Let's dive into some of the highlights. This year's report identified both the patient behaviors that remain steady since 2023, along with some new trends that are emerging. First, social media is playing a stake in consumer wellness trends. GLP-1 bookings surged this year. 2024 saw a 71% increase in semaglutide consultation bookings for males and a 50% increase for females. Bookings with sleep medicine specialists increased by 30% for women and 26% for men, potentially due to the viral Sleepy Girl mocktail and other sleep wellness trends. This year, there was also a 200% increase in blue light therapy bookings for females. When they looked at in-person versus virtual care, only 12% of all appointments booked in 2024 were virtual, compared to 18% in 2023. Mental health bookings continue to be primarily virtual. They're the only type of appointment to not skew in person. Younger patients are still more open to virtual care across all appointment types, with 18 to 42-year-olds being most open to virtual visits. Overall, patients are still booking with confidence. Nearly 9 out of 10 patients booked with in-network providers, and nearly 1 in 3 appointments took place within 2 days of bookings. Providers with 4 or more office photos received 5.8 times as many bookings, which was up from 4.8% last year. I laugh because I can still recall conversations with providers who think stuff like that doesn't matter, but it does. Providers who listed 2 languages on their profile got nearly 2 times as many bookings, and providers who listed 3 or more languages got 3.5 times as many bookings, up from 3x in 2023. And providers with more than 50 reviews received 10 times as many bookings relative to providers with 1 to 9 reviews. And providers with 100 or more reviews received 27 times more bookings relative to providers with 1 to 9 reviews. These findings overall are in line with other indicators about what's trending and why patients want to see their doctor. Just remember, there are more options than ever for consumers to engage in their health and wellness outside of traditional medicine or sick care, and we also need to take those into account as we consider what the future state will look like. Care models should reflect this new reality and lean in as much as possible to consider whole health journeys, including how provider visits will remain an important foundation of these journeys, even as more wellness products and services continue to spring up all around us. Let's use ZocDoc's report to refine the direction of our consumer strategies in the coming year and lean into areas where patient preferences are evolving right before our eyes. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. All right, everyone, it's time to get into the flow. Please join me to welcome my guest. It's an honor today to be here with Sarah Mastrorocco. Sarah is the Vice President and General Manager at Instacart Health. Sarah, welcome to the program.
Thanks so much, Jared. I appreciate you having me.
This is one of those that we, through no fault of our own, we've been trying and really appreciate being able to come on. And I'm excited to dive into what we're talking about today. But let's help our listeners get to know you a little bit better. Like, what's something most of them might not know about you?
I lead health at Instacart, which you might know about me, but I always tell people I'm a grocery nerd by background. I've been at Instacart for over a decade. I joined when it was 30 people in a house in South Park in San Francisco, and really love, the grocery industry, a big part of what people eat and, the business of grocery. And over the last 10 years have worn many hats, but the last 3 have really focused on access and now health.
It's fascinating how often access comes up. And so I definitely want to keep that as a theme here. For those who aren't as familiar with the Instacart Health story itself, like, what is that problem that they're trying to solve? What are some things maybe people don't know about it just from the surface?
Great question. And I always like to start at Instacart first. Hopefully you've tried Instacart and are familiar and a customer of our platform. But if you're not, Instacart is the leading online grocery platform in North America. And what that means is we're an app that powers over 1,500 retailers and 85,000 stores across the U.S. and Canada in a one-stop shop to get what you want. We serve over 98% of U.S. households with same-day fresh grocery delivery from a large conventional grocer and other stores that you can choose. And we also serve over 95% of people living in food deserts. So at our basis, just Instacart itself is an access platform. And Instacart Health, the idea for Instacart Health really came out of COVID, like many ideas did, where grocery moved from a convenience to a necessity for many. What we found during COVID that people used Instacart and we were a lifeline to many. And we always knew that health starts at home, and really marrying those two. Instacart is a 12-year-old company. We've been at the intersection of food and families and now health. And when we thought about Instacart Health, we thought of what are the ways that we are playing a role in people's health. And there's really 3 ways that we came to market as an Instacart Health platform. The first is increasing access. And I talked about our physical access, but we didn't talk about our financial access, which is also a large part. We pioneered paying with EBT SNAP online with the USDA during COVID too. And we're excited to be the first marketplace to go national. We're in all 50 states and Washington, D.C., over 30,000 stores accept EBT SNAP payment. And it's so important not just to get delivery for people, but to be able to pay with whatever money you have. And we call that our health wallet. And we have our own payment system. I'll talk about more of it as Fresh Funds. So that first pillar of Instacart Health is physical and financial access. Once you have that, though, the next pillar is how do we make healthy choices easier? And that's, online shopping. That's tags, like dietary tags. Is this low sugar for me? Is it gluten-free? Might this meet my keto diet? So really working with people to make healthy choices easier in that way. Are there recipes and lists that we can pull both on the platform, but off platform too? We have a developer platform that anyone can use the Instacart platform to make their advice shoppable. So and those 2 pieces combined. So the access to food, making healthy choices easier. When we package that together, a big part of what we do is work with healthcare organizations to break food as medicine and food care and food interventions to life. So that's our third pillar, which is really a food as medicine and intervention pillar. So we work closely with health plans, providers, nonprofits, even governments on bringing these programs to life. And our reach and our scale and our household name and brand trust really helps us bridge that gap for people. And we're excited that we continue to lean into that with our products, our platforms, and our partners to make the vision come to life, that everyone can have access to nutritious foods and information they need to lead healthier lives.
Fantastic. Thanks for sharing that big picture here. Now, what about if we zoom in to 2024? Are there some things that Instacart Health has accomplished that you want to celebrate? And any other announcements you'd like to share?
I always like to use examples to describe what we're doing rather than talking generalities. So thanks for asking. And good that it maybe took us a while to meet again, Jared, because this is a great week, that we are able to share a lot of examples of how we're expanding Instacart Health goals and reaching more people. We became the first online grocery platform to launch a SNAP eligibility screener. And it is a new tool that takes less than a minute, and it's available to customers, really anyone. You can go on nationwide. And so it's www.instacart.com/EBT-SNAP. And there's a screener there, and it's anonymous. You can go answer questions anonymously, and we will tell you if you might be eligible for SNAP and then based on your location, send you exactly to the resources online for that state to help get you started. We've seen, just since launching, we've seen tons of great press and people really receiving it well. Just being a one-stop shop for people, just giving peace of mind that, hey, let me know if this is an option for me. There are so many people out there that don't know if they're eligible and might wonder and not sure where to go. So we're a resource for consumers, but we're also a resource for our healthcare partners. As part of this announcement, the National Association of Community Health Centers also celebrated it. I'm not sure if you're aware of NAC, that national org or community health centers. Being a grocery nerd, I was not familiar with NAC until about a year ago when it was connected to them. And I'm so excited about the work they do and everyone I meet at a community health center. They serve 32.5 million people a year, many people on Medicaid, some uninsured. And social determinants is a huge part of what they're doing, right? About any primary care provider or people serving underserved communities often screen for nutrition insecurity, asking people, but don't have easy resources to help them. And we're excited that this can be one way that they can easily help. Hey, might you have a problem with nutrition insecurity? Do you know where your next meal is coming from or access to healthy food? Here's a screener. Let's spend 60 seconds together, or I can send you this link and you can do it yourself. So very excited about just this free, easy tool. If you want to use Instacart, great. We'd love you to use Instacart. It's very popular, EBT Snap, on the Instacart platform. And that is because Instacart solves for really 4 key things that we've been told by our EBT Snap customers. It's time and transportation, which seem maybe obvious, a lack of time, a lack of access to reliable transportation to get to stores with good prices and great quality food. The second, after those 2, it's a stigma sometimes of using financial assistance, and it's anonymous on Instacart. And then sticking to a budget. I always remind people, and it wasn't intuitive to me, but when we learned that people can use Instacart in very different ways. And our goal is to make Instacart accessible on any budget. If you would like it right now and want to pay extra, great, we're there for you. But we also let people stick to a budget, pull things in and out of your cart, which is not natural in a physical store, right? And we also let people order in advance and maybe waive delivery fees because you're choosing a 3-hour window or a next day. So we're excited about those options for people that are more budget sensitive, that can actually save a lot more money while they're saving time. So that's just one announcement this week and kind of the context around it. Excited about leading into helping more people get access to food and access to funds that might already have they've been able to access. Next one, earlier this week, just a few days before, we announced our first partnership with a managed Medicaid plan, and that's Molina Healthcare of Michigan. And that's to support Medicaid enrollees facing barriers to access to nutritious food, focused on expectant moms, and something near and dear to my heart. I'm a mom of 2. I know that pregnancy and giving birth to a child and the time period after it is challenging for anybody on any budget, with any resources. And what a great opportunity to work with Molina, Michigan. There are 600 expected moms that have been identified as facing food insecurity, and they're using our Fresh Funds program, which is a directed spend program that works on Instacart. And they can give a stipend that's electronic, really a link you send to somebody. I could send one to you, Jared, and you click on it and $100 gets loaded into your Instacart account. And you'll have a Plus membership that comes with it. So you have waived delivery fees. And then every month that refreshes. So you can use the $100. And then in the next of the month, for 9 months, you would get another $100. So that's really making sure that people have an easy way, especially pregnant moms who might often have physical and financial issues to get to the grocery store, a quick way that they can get access to healthy food. And Molina Healthcare of Michigan has chosen what they want that stipend to work on, which is awesome, right? It's like it can be healthy foods, but healthy foods maybe for expectant moms in mind. So that's really what we feel our technology is bringing to the table. It's the Instacart platform that people know and trust, but it's not just Instacart. It's that I'm shopping from Aldi on Instacart or my local co-op or Costco, right? I can use that money in the store that I choose, but on products and categories that Molina of Michigan had told me are good for me and my baby. A stat that really blew me away too is pregnant women who live more than 1.5 miles from a grocery store are 3 times more likely to have a child with a low birth weight.
Wow.
So I'm really excited that we're working together. Yeah. We are working together to break down physical and financial barriers of healthy eating. And we want to support better health outcomes for moms and babies. So those to me, like this week, those are just awesome examples of how Instacart as a consumer health platform can partner to expand access to government programs, but also directly with managed Medicaid plans to give their members real tangible benefits that they can feel comfortable utilizing.
I love that, because I was going to dive into what consumer insights particularly had driven some of Instacart's services, right? And that's because we talk a lot about that on this show, about using consumer behavior insights, understanding truly how somebody engages in their health and wellness to drive service design based on those insights. And those were great examples of that. I mean, the figure about low birth weight, like that's just, to be able to pinpoint it, I think is half of it for me. I'm like, that's incredible, because then you know what to do a lot better based on the sites. So I just love that thought. I mean, it kind of just rolls up to this whole thought of understanding how tech enablement companies, because I imagine that's how Instacart Health considers itself, not a provider itself, a tech enablement company that's empowering or enabling these services. Mm-hmm. How do you think this category of tech enablement companies can ultimately improve people's health?
I love that. I'm glad you asked that question. And I agree. We are an enablement platform, not a disruptor, right? We're here to enable. And I think when we approach healthcare partners, we learn from them and then they learn from us on our consumer lens. And when we talk about consumer insights, as a consumer technology, but really consumer app too, we power the Instacart app. We power 600 different retailer grocery apps as well, which people don't realize. We're a white label provider with Instacart Storefront Pro. And that gives us a lot of insights into how people shop. And we're obsessed with listening to our customers, understanding changes and how people react. And I think that mindset is great for healthcare too, right? So it's let's understand how people shop, how they want to shop. If we throw a dietary tag out there, we're not just throwing it out there and being like, great, I hope people use it. We're going to see how they use it. How does this help people? Does it improve their baskets, or does it change the way they behave? They might provide us feedback directly. So I think that loop can be so powerful that we're not just here to, provide a service and hope it works. We're constantly listening to our healthcare partner, but the end user too. We really are a B2B2C in the healthcare world. And we're excited to continue to lean into that. And I think that many in the healthcare world are embracing that too. I always tell people that grocery delivery is hard, and I don't recommend you go start another grocery delivery company. Let's let you do what you're experts on. And that is identifying at-risk mom, right? And to providing healthcare services as a provider. But if there's an easy way that you could reach, for example, Michigan moms, to both offer them a fresh funds of $100, but hey, this platform also accepts your EBT SNAP card, and you can add your own funds and complete your whole shop. That's very different than here's an intervention and it's exactly for this, and then it's a one and done. We can really create lasting, sustainable behaviors together that I don't think anyone else that doesn't have a consumer platform or a regular audience that's trying to constantly get better for that consumer audience can match that same level of service.
It's a piece of this puzzle that speaks in the name itself of this category of tech enablement. It also powers these partnerships with health plans, with providers who, whether they can do something or not, it's kind of not the point, is what I've kind of been learning lately, right? It doesn't necessarily make sense for them to try to build additional connections and try to enable certain services themselves. It makes sense for them to partner with those who already have the platform figured out. And that loop of what you said, of learning from those insights, of learning what worked and what didn't, and how behavior changes based on so many confluences of factors. So there's just a lot in there that drives future innovation as well.
I love that you said that. And that made me think of one more thing. When we think about, we can run a full program like Melina in Michigan, but we also can enhance programs. And that's another thing that we really talk about with our healthcare partners is, what are you doing today? How are you spending money? Or what are your goals? Is your goals to engage people better? Is your goal to provide, real nutrition security and deliver health outcomes? And a great example of a large provider we work in the registered dietitian nutrition space is FoodSmart. And we released a white paper with them about a month ago. And they've been working with us for years. So it was awesome to have data that, years of data with over 18,000 people that were part of Instacart in combination with FoodSmart. And the results are just amazing. We're so excited. We know that food helps. So we know that Instacart engages people, but now we have results that show, when looking at just an RD program, like the FoodSmart program, which is powerful in itself, but combining FoodSmart with Instacart Fresh Funds, as part of that program, diabetes management increased 53% of members with diabetes who had the combined program saw a reduction in A1C compared to 43%. People achieved 5% weight loss, 50% higher rate, almost double the engagement in the program. So just having people stick with the program, which we know works, is powerful. And really better nutrition scores, asking people how, did they improve their nutrition? People saw an 8.6% improvement in nutrition scores compared to 3.3% using telenutrition alone. I feel like there's an engagement, there's ability to try things, right? What you want with fresh funds. And what we all want is improvement in health outcomes, right? So that reduction or improvement in weight health and a reduction in your A1Cs. Really excited to lean in to our provider partners and our health plan partners and say, we bring food, we bring technology that can give people dignity of choice within food. And now we are continuing to roll out successful results that show those outcomes with numbers, not just, of course, we know this works.
Talking about the nutrition side here, when we think of some of these other pieces, that the insight that question has been based on is how consumers don't necessarily compartmentalize healthcare on one side, wellness on the other side. They're just like, what lever do I need to pull today to feel better? And it could be from a traditional healthcare visit, or it could be something that is one of these adjacent areas like nutrition or fitness or weight loss or mental health or sleep. Are there any of those areas that you think kind of make sense to bundle with with nutrition services that are just kind of like naturally like at these kind of complement each other a little bit better, or just in general makes sense for providers to do more with partnering?
I love the push of let's think about everything holistically, right? And for Instacart, I can see the same. There might be parallels to what are people using for their fitness, right? Is it Peloton or Apple Health? And I think all of those companies are very motivated to be seen as solutions and really enablements for healthcare, right? Not just wellness, to your point. What Instacart has done is in the last year in March, we rolled out a developer platform. So anyone can use Instacart. And I think that's healthcare providers, but it's also these tech-enabled consumer platforms. Weight Watchers, all of their meal plans are integrated. So at the tap of a button, you could get 32 items added to your cart on Instacart. New York Times Cooking, very popular. Not healthcare, but it's still cooking at home. We know is healthy, right? And inspiring people. Very popular. We have a partnership with them that if you have a Plus membership, you get access to New York Times. But anyone who has New York Times Cooking can tap the button and get that recipe shoppable. And I think that's an example of maybe just creating this ecosystem where partnerships are easier and that we're making food easier, but I can see that happening across the wellness world from commercial healthcare space too. I think is very popular in integrating everything.
Sarah, one last question. I said that was my last topic, but my last question would be, what gives you hope for healthcare in this country, for our future of where we're going? I always love just asking about the destination of where you hope we get as a result of all these efforts. I'm
encouraged by the continued focus on nutrition, right? Both access to nutrition and in the wellness space and in the healthcare space. And I see a world where a lot of the work we do is on access in underserved communities. I'd love to see a world and continue to see momentum toward where nutrition and food vouchers and our fresh funds vouchers can be covered benefits for many programs, right? If you are identified with a chronic disease and nutrition security, that it would not be unheard of, or it might be the standard to offer fresh funds on Instacart as part of a food intervention. But in general, any consumer coming to Instacart should be able to access, and we're continuing to invest in all the ways that they can be healthy based on their specific needs. And there isn't a one size fits all for health. It really is working with your provider, working with your nutritionist, understanding what works for you. But we continue to invest in technology and partnerships to make sure that anyone can have access, physical, financial, and information access to lead a healthier life. So I'm excited to continue that journey. And I do see a ton of momentum, especially for 2025 and beyond.
Thanks so much for joining us today and giving us so much to think about. It's been a pleasure to speak with Sarah Mastrorocco from Instacart Health. Thanks so much for joining us.
Thanks, Jared. Appreciate it. It's been great.